Kinnock, very good morning to you.
Good morning. Hello. Hi.
Thanks for joining. So I wanted to start, if we could, on this extraordinary report that our Rachel Venables has done, which I know you're aware of, in terms of exploring the state of play in the ambulance service and specifically some of the sort of sexual harassment and worse and different factors that individuals in the service have to go through. Is it something that you recognise exists and is something that you're trying to address?
It's deeply disturbing. Frankly, horrified to read some of these reports, and we have to leave no stone unturned to ensure that if this behaviour has been going on, that it's rooted out, that people are held to account, and that we ensure that it never happens again. So we are looking at this very closely, and we'll certainly be keeping people updated on what we're doing in terms of the investigation and ensuring that no stone is left unturned until we've got this sorted.
And what exactly is going on at the moment? Is that there's a formal investigation or it's an initial sort of exploratory inquiry?
Well, it's very recent that we've got this information, so I think we need to now really digest it, understand it. Of course, we'll need to verify it. I'm absolutely sure that your journalist has done a good job in terms of ensuring that it is accurate. And if that is the case, then action will have to be taken, whether that's disciplinary action or even any other further measures that might be necessary. But we will do whatever it takes to root out this kind of behaviour from the ambulance service.
Sexual harassment is one thing. What was your reaction to see the images of a Nazi flag as it was shown in the reporting amongst ambulance service workers?
It's horrific, and I think we all know the impact that seeing a Nazi flag has. We know what it means, what it symbolises, and it is utterly disconnected from the values of our NHS. And we have to ensure that every single employee of our NHS, every employee of the Department for Health and Social Care, from the Secretary of State down, is modelling the right behaviours, and those behaviours are about being inclusive and being about values and about being about our, what we're there to do to serve the public. It's certainly not having Nazi flags around.
Moving on, I wanted to explore what you're announcing today, an upgrade to the NHS app. Is this a sort of run-of-the-mill upgrade, or is it something that's going to actually make a difference?
Well, the big news with it really is the increased coverage that we've got. So we inherited a situation where over 30% of trusts were not even connected to the app. I'm delighted that we've got that up to 87% today. What that means, just since the 4th of July, is 1.5 million that would have been missed appointments. Those missing of those appointments has been prevented. 5.7 million hours of staff time saved, £612 million of staff time saved, 12 million letters that didn't need to be sent, not being sent, also saving a lot of time and money. So it's really good for productivity, but it's also really good for the patient engagement with the system. For example, you don't need to fill in a questionnaire when you're in the hospital in front of the nurse. Do it online. When you get down there, you're going to then move through the system more smoothly. Patient outcomes will be improved. So it's part of our shift from analogue to digital. We want to get the NHS out of the dark ages in terms of technology. It's a huge opportunity to drive up efficiency, drive up productivity, and improve patient outcomes.
I don't know if morale is up or not, and I don't know what hard data you have on that in terms of employees of the NHS, but it seems like another row is brewing between government and public sector workers over pay. Would you support the government deciding to put in place in full what the independent body has suggested for pay rise, or do you think, following significant pay rises over the last year, that there has to be some middle ground this time?
We've received the recommendation of the pay review body, and we will give that very careful consideration. This government is about putting more money into the pockets of working people. We sorted out the junior doctor strike last year. As a result, we've got doctors off the picket line onto the front line, and that has led to waiting lists falling for 6 months now on the bounce. We've also seen an increase to the national living wage. We've seen interest rates falling 3 times in a row. So we're all about putting more money into the pockets of working people. But we do also have to ensure that we are balancing the books. And we've got to work in terms of public sector pay within fiscal constraints. So, of course, we will give these recommendations careful consideration, but I would, of course, also urge our colleagues in the trade union movement to engage constructively with us and recognising the reality of the financial position.
Immigration's a hot-button topic, we all know that. Should EU youth mobility be caught up in that, or is it actually something that appeals to people to have that freedom for young people to move around?
Well, I think we've been very clear that we're not going back to free movement. We're not going back into the single market or the customs union, but we are looking to strike the best possible deal for Britain in the national interest. The European Union is a vitally important partner for us, both in terms of trade, in terms of our security, in terms of our scientific cooperation, a whole range of areas where it's such an important partner. So my colleague Nick Thomas-Symonds is leading on the negotiations with the European Union. We've got a very important summit on the 19th of May, and I'm confident that we'll be able to strike a deal that is a big improvement on the utterly botched Brexit that Boris Johnson did, which has cost the economy billions and is creating massive amounts of red tape for businesses.
Do you like the idea of EU youth mobility yourself?
I think that it's got to be part of a package that works for us in the national interest. There's a negotiation going on. It's best not to conduct those negotiations here on live TV. But I do think that as part of a package, it is a very interesting proposal, and it's something that it will be explored as we go towards the summit on the 19th of May.
Stephen Kinnock, thanks for joining us. Good to see you.
Thank you very much.